This little video is going to be about my thoughts on how Ozempic can be used best in the context of the obesity disease. My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and I don't actually prescribe these medicines, but I see a lot of things come and go, and I think that the GLP medicines are going to be a tremendous tool. I think that they are going to be best used if they're used in the overall context of bariatric treatment options. So the GLP meds are very powerful, and they can be game changers in what we have as a battle against obesity disease. They can have an amazing positive impact on weight and associated diseases. They can help a person shut up the food noise for the first time in many years. They can feel in control for the first time since they remembered. But like any tool, they need to be used with strategic intelligence. And intelligence understands a few things. Strategic intelligence understands that obesity is unfortunately a lifetime disease. Intelligence understands that the obesity disease is variable, meaning the treatment needs to be selected for each individual, and that obesity disease evolves, which means that treatment needs to be changed periodically over time. Intelligence understands also that, like in cancer therapy, we often need more than one tool to get the job done. And the last point, to say the same thing in a different way, in the obesity disease management, there really isn't one single silver bullet treatment. One of the drivers for me posting this video is that unfortunately it looks to me like the most common way of using these cool new tools, these GLP medicines, is kind of old-fashioned management plans for the obesity disease. And the most common error that I see is that the meds are being used in isolation. Especially pop-up weight loss clinics and commercial plans are weak on the lifestyle modification, which I think is foundational for any treatment plan. And this is not even to mention options of using possibly multiple meds in combination, or rotating medicines, or adding in surgical options. So to use one treatment in isolation is not going to work for the majority of patients. The second error that I see is this idea of short-term treatment. And I don't even know where this came from, but the tradition in America is that weight management should be done for certain time-limited periods. I mean, pick your time. Could it be 3 months? Could it be 48 months? Could it be 3 years? But there's this recurring idea that the medicine should be used for this time, and then it's done. And that just misses the point of the underlying medical condition, which doesn't go away. We have to manage it in the long-term strategy. And not only should we think that we need to continue treatment for the long run, but we need to be open to the idea of modifying treatment as the disease evolves in the long term. The third error that I see with old school thought processes is that there's not any plan for taking care of side effects. And side effects are pretty common with the GLP medicines. It's not a surprise because they are having significant hormonal effects. And most of these side effects can be managed, but you need an educated opinion to know if these side effects, these particular side effects in this particular patient, are something to kind of ride through, or is it time to bail out and change medicines, or to find out that medicines aren't going to work. It takes experience to know which way to go, and there needs to be a plan B, a plan C, etc. And one of the new errors that we're seeing become increasingly common is that the medical team and the patient can be too persistent with the medicines when they're not working. We see sometimes that the medicines don't work or they stop working, but the team sticks with the failed medicine, somehow hoping for a return to the original positive impact. We call this a therapeutic dead end. These problems with misapplication of the GLP medicine seem to happen most commonly at pop-up weight loss clinics or big commercial weight loss firms. These firms measure their revenue, expenses, their cash turnover, how much do they prescribe, how many supplements do they sell. They might track weight, but they're not really measuring their business outcomes from the standpoint of their patients' health. Sitting here making this video, I don't know the best plan for you. What I suggest is for you to find the right team. The right team has a long-term focus on obesity disease management. They're experienced, dedicated, long-term, multidisciplinary, and the team has more than one tool in the toolbox. I mean, you can imagine that a builder isn't going to show up to raise a barn with just a hammer and to do it alone. Instead, the sensible building team is going to bring lots of tools and other builders as well. So I want your team to be formed in that way. So for weight loss and metabolic health, I think that the ideal combination of tools is some combination of healthy lifestyle, we can even break that down further, plus medicines, plus options, not requirements, but options for surgery. You'll know you found the right team when they're ready to discuss all your options and when they have the willingness and knowledge to update your plan and to make it work for you in the long run. I wish you the best of luck on your journey.